All right, so the two manipulations or high velocity thrust techniques that I'm going to show to you today is first is going to be the Midthoracic manipulation. The second one is going to be the Cervicothoracic Junction manipulation. And then they performed this in a study by Stephanie Muth et al. And they did these manipulations on patients with rotator cuff tendinopathy. And if a patient comes in with rotator tendinopathy, the clinical predictors for a manipulation would be negative Neer's test, flexion over 130 degrees, less than 53 degrees of internal rotation at the glenohumeral joint, shoulder pain less than 3 months, and not currently taking NSAIDs. In the study, the results of these manipulations, it didn't lead to any changes of range of motion or scapular kinematics. However, it did create a small but significant increase in the middle trap activity. However, it did significantly decrease pain in the shoulder. So we're gonna go through these techniques now. The first one, I'm gonna have the patient wrap around his body with his arms just like he's giving himself a hug. Okay, then I'm gonna come around here, I'm gonna lock hands, and I'm gonna squeeze. And now I'm gonna kind of just get him to relax. I want him to take a deep breath in and then a deep breath out. I'm gonna do kind of a J stroke, get him to relax, bring him back a little bit, then apply a thrust, just like that. So that was the Midthoracic manipulation. I got you pretty good there. Okay, so the second one is going to be the Cervicothoracic manip. I'm gonna have to kind of get up here because he's kind of tall. Just like he has here, he's going to bring his arms back and lock his hands around his neck as far as he can. I'm gonna come under his arms just like this. I'm gonna lock mine. Same thing, I'm gonna have him take a deep breath in, deep breath out. I'm gonna get him to relax, bring him back, and apply a thrust upward.